especially arterial, on the neck or something like that, then they say you have to put an occlusive dressing that doesn't allow any air in, because you can be sucking air in, and that can go and cause an embolism. That actually happens where actually we see that a lot is with IVs, is that somebody's getting an IV and a whole bunch of air gets pushed in. That can kill them. A lot of times you don't end up necessarily with pulmonary artery, a lot of them they end up with strokes related to them. But there was a case that happened 3 years ago down in New Orleans that I was aware of where that happened, and the patient actually died because of it. But so that's why, you know, when you later down the road when you're setting up IVs, you'll learn all about not letting any air in. Pulmonary embolism, so sudden onset of unexplained dyspnea and chest pain. So, you know, these are the patients that, like I said, their lung sounds are gonna sound great, but they're like, I can't breathe, you know, satting 60%. Signs of hypoxia with normal breath sounds and adequate volume. And unfortunately, these are patients that, you know, you can't really do a lot if the entire pulmonary artery is blocked, the patient's already dead. The patient isn't gonna make it. What they need is they need to be in surgery. So if it's blocked, everything is called a saddle embolism. So the saddle from the pulmonary artery then blocks off or branches off down into the lungs. If the saddle embolism is blocking off everything, then it's like the patient just stopped breathing. So then you've got like it's effectively the equivalent, but the patient's still going to be breathing, but physiological equivalent of
they're going to still be breathing, but it's just not going to get into the bloodstream.
Yep.
Because, okay.
Yep. So, you know, these are the patients that, if you see them, they're basically already dead.
There's nothing we can do at all.
We can transport them.
Yeah, I mean, get them to the hospital as soon as possible. You know, in the hospital.
Surgery or?
Yeah, so there's you know, emergency therapies, like in the ER, you can give them what we call thrombolytics to help try and break up a clot. That you know, I've done twice ever, but that's really like the patient's in the ER and they're not going to survive to get up to the OR. You give them a drug that's meant for strokes to break up clots for strokes. You push this drug and hope that it works. And I've seen it work once. Yeah, so the big thing is that their respiratory system they're gonna sound great. They're gonna be breathing 20 times a minute, totally fine. But they're gonna be cyanotic. They're gonna be crashing in front of you. So you can maximize, you know, what they say is that you can maximize what they do have available with giving them as much oxygen as possible. Like we would intubate and give them 100% oxygen and just maximize everything that is still available. But if everything is blocked off, there's nothing to maximize. Like if the left side is blocked off, you still got the right side you can try and maximize. But yeah, it's rough. Open airway, administer positive pressure ventilations, maintain SpO2 of 94% or better. Include lower leg assessments for DVTs. So does everybody know what a DVT is? We'll sort of talk about it a little bit. So like we had said, you know, patients can develop blood clots when there's blood stasis, when the blood just isn't able to move well, and it's more easily able to develop clots. A lot of times where they end up developing is lower legs, because, you know, lower, that's where blood flow can be slowest if they're having problems with pumping. So a lot of times, you know, patients will, you know, come in, their legs will be red because they've got this big clot down there that's blocking the flow back up. And then, you know, they're like, yeah, you know, I had this leg pain for a week and now all of a sudden I've got shortness of breath and trouble breathing, all sorts of stuff. It's because that probably that blockage migrated up into the lungs.
Is that more common in overweight or obese patients?
Yes. So,
Isn't that, I'm sorry,
No.
bariatrics, is that the term for that?
Bariatrics.
Yeah.
Okay.
so which of these best characterizes emphysema? A, structure of the alveolar walls with extension of the alveoli. Acute pulmonary edema. So pulmonary edema is when there is fluid accumulation in the alveoli, in the lungs, generally because the heart isn't able to pump well. And when the heart isn't able to pump well, a lot of fluid that's running along the borders to collect in the capillaries to collect the oxygen, that blood flow depends on the heart pumping